Hey everyone, let me know in the comments where you're watching from and what time it is for you. It's always fascinating to see our global community coming together to explore history. Now, settle in, maybe grab a cup of tea, and let's journey back to a time when medicine was equal parts mystery, confidence, and pure chaos. You are a medieval doctor, and you're about to have the strangest, most terrifying, and oddly hilarious day of your career. Not because you'll save lives, that's honestly optional, but because you'll navigate a world where logic takes a back seat to tradition, and tradition takes a back seat to whatever sounds impressive in Latin. You wake before sunrise in your timber-framed home, the air thick with the scent of damp rushes scattered across the floor, tallow candles from last night's studying, and the lingering aroma of yesterday's pottage. Your bed is a straw mattress covered in rough wool blankets that scratch against your skin. The pillow beneath your head is stuffed with goose feathers, a luxury that marks your status as an educated man. You're 32 years old, which in medieval terms makes you practically ancient. You've survived childhood diseases, several plagues, and more bloodletting sessions than you care to remember. Your hands are stained permanently with ink from copying medical texts, and there's a small scar on your thumb from that unfortunate incident with a bone saw last month. You stretch, feeling your joints protest against the cold morning air. Through the small oil paper window, you can see the first hints of dawn creeping across the thatched roofs of your town. The church bells haven't rung yet, but they will soon, calling the faithful to morning prayers. You'll attend, of course, not just for your soul, but because half your patients will be there. And networking is everything in medieval medicine. But first, you need to prepare for the day ahead. You reach for your basin, filled with water that was heated by your servant girl before she disappeared into the kitchen to start the morning fire. The water is lukewarm now, but it's clean, cleaner than what most people use. You splash it on your face, wincing at the cold, and reach for your razor. Yes, you shave, not because you understand anything about hygiene. That's still centuries away, but because a smooth face suggests you're civilized, educated, and definitely not a barber surgeon who might accidentally amputate the wrong limb. The distinction is crucial. You are a physician, trained in the great medical traditions, not some tradesman with a sharp knife and questionable judgment. You dress carefully, each garment a statement of your profession and status. First, a linen shirt, soft against your skin, and white enough to suggest cleanliness. Over this, a woolen tunic dyed a deep blue, expensive enough to command respect, but not so flashy as to suggest vanity. Then comes your most important piece, the long robe. This isn't just clothes, this is your diploma, your business card, and your shield against skepticism, all rolled into one flowing garment. The robe is made of fine wool reaching nearly to your ankles, with wide sleeves that could hide a small library. The color, a rich brown or black, suggests scholarly seriousness. The length suggests you don't need to do manual labor. The expensive fabric suggests you're successful enough that people should trust you with their lives. You fasten the robe with a leather belt, from which hangs a small pouch containing your most essential tools, a few coins, a piece of parchment with some illegible notes about humoral theory, and a small vial of rose water for when things get truly unpleasant. Finally, the hat. Oh, the hat. This is no ordinary cap. This is a statement piece that could probably be seen from space if space observation existed. It's tall, pointed, and made of felt or fine cloth, rising above your head like a textile monument to your education. Some days you wear the academic cap with its distinctive peak. Other days you opt for the more practical coif that ties under your chin. Today you choose the tall hat, because you have house calls to make, and first impressions matter. You pause before a polished metal mirror, one of your few luxuries, and adjust the hat's angle. Too far forward, and you look like a peasant trying to hide. Too far back, and you look like you're about to fall over. Just right, And you look like a man who definitely knows what he's doing, even when he absolutely doesn't. Your medical bag sits by the door, and you check its contents one final time. Inside, a collection of items that would make a modern doctor weep or laugh. Possibly both. There are your knives. Not scalpels, just honest, sharp knives that you've repurposed for medical use. They're cleanish, which is more than most people can say about their tools. You have your cupping horns, made from actual animal horns, used for bloodletting. There's a small hammer for checking reflexes. Just kidding. That won't be invented for centuries. The hammer is actually for knocking people unconscious when surgery gets too screamy. You have rolls of linen for bandages, though you're not entirely sure about the whole sterile concept yet. Your herb collection fills several small pouches. Willow bark for pain, which actually works. Pennyroyal for women's complaints, which might work but could also kill. And mandragora for serious procedures, which definitely works but might also kill. It's all about dosing, and dosing is all about guessing. There's also your urine wheel, a circular chart showing different colors and what they supposedly mean. Clear urine suggests cold and moist humors. Dark urine suggests hot and dry humor. Blue urine suggests witchcraft or someone's been eating too many berries. It's all very scientific. You grab a heel of bread and a cup of small beer. Water is for washing, not drinking, unless you enjoy dysentery as a hobby. The bread is coarse and dark, made from whatever grains survived the last harvest. The beer is weak, barely alcoholic, but safe and nourishing enough to get you through the morning. As you eat, you review your mental notes for the day. There's the merchant's wife with the mysterious swelling. Probably pregnancy, but you'll diagnose an excess of blood and recommend gentle exercise and a reduction in rich foods. There's the baker with chronic coughing. Definitely too much flour dust, but you'll blame it on corrupted air and prescribe burning sweet herbs in his shop. And then there's the nobleman's son who's been acting strangely, talking to invisible people, refusing to eat, wandering naked through the gardens. His family wants you to fix him, preferably quickly and quietly. You're already planning to blame it on an excess of black bile and recommend a pilgrimage. It's amazing how many psychological problems clear up when people walk 500 miles. You finish your breakfast, wipe your hands on a linen cloth and step outside into the awakening town. The air is crisp with morning dew and you can smell bread baking, animals stirring, and the ever-present undertone of human waste that characterizes medieval urban living. It's not pleasant, but it's home. The streets are narrow, barely wide enough for a cart, and lined with houses that lean precariously toward each other like drunken friends. Upper floors jut out over the street, creating a canopy of timber and thatch that blocks much of the sky. The ground beneath your feet is packed earth mixed with straw, and you're careful to avoid the worst of the puddles and piles. Other early risers nod respectfully as you pass. The baker, flour dusting his apron, pauses in arranging his wares to bow slightly. The blacksmith, already at work despite the early hour, looks up from his forge to acknowledge you. A group of women heading to market with baskets on their arms step aside to let you pass, murmuring greetings. You nod back, maintaining the dignified bearing that befits your station. You are a learned man, a healer, someone who can read Latin and understand the complex workings of the human body. At least that's what everyone believes, and belief is half the battle in medieval medicine. The church bells begin to ring, their bronze voices calling the faithful to morning prayer. You adjust your pace, ensuring you'll arrive at the church in time to be seen by your patients, but not so early as to suggest you have nothing better to do. Timing is everything in the delicate dance of professional respectability. As you walk, you mentally prepare for the day ahead. You'll start with prayer, not just for spiritual reasons, but because it's good business. Then you'll make your rounds, visiting the sick, dispensing wisdom and collecting fees. You'll consult your astrological charts, examine urine samples, and possibly perform a small surgical procedure if you're feeling confident. It's going to be a long day filled with uncertainty, improvisation, and the constant fear that someone might ask you a question you can't answer with authority. But that's medieval medicine for you. Part science, part performance art, and part survival strategy. You straighten your shoulders, adjust your impressive hat one final time, and stride forward into the day with the confidence of a man who absolutely knows what he's doing, even when he doesn't. The first thing you need to understand about being a medieval doctor is that medicine is only about 30% of your job. The other 70% is performance art, and you are the star of a one-man show called This Person Definitely Knows What They're Doing. Your success depends not on how many people you cure, that's almost secondary, but on how convincing you are when you stride into a room and announce that someone's spleen is obviously being influenced by Saturn's position relative to their left kidney. Say it with enough confidence, and people will pay you handsomely for the insight. You've spent years perfecting your professional persona, the way you hold your head tilted slightly, as if listening to wisdom floating down from the heaven, the way you pause before speaking, just long enough to suggest deep thought, not so long that people wonder if you've forgotten the question, the way you nod when examining a patient, slowly, thoughtfully, with occasional sounds that suggest you're seeing things invisible to lesser minds. Your Latin helps enormously. Most of your patients speak only the local vernacular, so when you mutter temperamentum sanguineum in excessio, while feeling someone's forehead, they assume you're channeling centuries of medical wisdom rather than basically saying this person feels warm. The more Latin you use, the more impressive you sound. Even if you're essentially describing the obvious in a dead language, you've also mastered the art of the meaningful pause. When someone describes their symptoms, you don't respond immediately. Instead, you stroke your chin, gaze thoughtfully at the ceiling, and make a small ah sound, as if the pieces of a complex puzzle are falling into place. Then you nod slowly and say something like, "Yes, this aligns with what I suspected," even though you suspected absolutely nothing until that moment. Your handwriting is deliberately illegible. When you write prescriptions or medical notes, you make sure they're completely unreadable to anyone except other physicians. This isn't because you're hiding ignorance. Well, not entirely, but because illegible handwriting suggests complex, sophisticated thinking that ordinary people couldn't possibly understand. If a patient could read your prescription, they might realize you're just telling them to drink more water and avoid spicy foods. You've learned to ask questions that make you sound knowledgeable while actually gathering information. Instead of saying "what's wrong with you," you ask things like, "Has the corruption in your blood manifested as heat in the extremities or coldness in the vital organs?" The patient has no idea what you're talking about, but they'll try to answer, and their response tells you everything you need to know about their actual symptom. Physical examination is mostly theater. You feel their pulse, not because you understand what different pulse rates mean, but because putting your fingers on someone's wrist looks medical. You examine their tongue, because tongues apparently reveal all sorts of things about internal health. You look at their fingernails, peer into their eyes, and occasionally press on their abdomen while making thoughtful noises. The key is to touch them with authority. Your hands should be warm, clean, and confident. Never hesitate, never apologize, never admit uncertainty. When you press on someone's stomach and they wince, you nod knowingly and say, "Yes, as I expected. The yellow bile has settled in the gastric region." They don't know what that means, but they're impressed that you could tell just by poking them. You've also developed a repertoire of wise sayings that apply to almost any medical situation. The body seeks balance, and we must help it find its natural harmony. Disease enters through disorder and exits through order. What affects the mind affects the body, and what affects the body affects the soul. These sound profound and are vague enough to fit any condition. When you don't know something, which is often, you blame it on factors beyond immediate control. The patient's diet, their lifestyle, their moral character, the position of the planets, the quality of the air, or the mysterious workings of divine providence. This not only explains your limitations but also makes the patient feel responsible for their own recovery. You never promise immediate results. Instead, you talk about the healing process, the body's natural rhythms, and the time needed for your treatments to take effect. This gives you weeks or even months for the patient to either get better on their own, or for you to think of something else to try. Most importantly, you surround yourself with the trappings of scholarship. Your home contains books, actual books, not just scrolls or tablets. You can read, which puts you in an elite minority. You know the names of ancient physicians like Galen and Hippocrates, and you quote them regularly, even when their advice has nothing to do with the current situation. Your medical bag is carefully organized to look impressive when opened. The instruments are arranged just so. The herbs are in clearly labeled containers, and everything has a place and purpose. When you open that bag in front of a patient, it should look like you're revealing the tools of ancient wisdom, not just a collection of sharp objects and questionable powders. You've learned to make every patient feel like their case is uniquely interesting. This is quite fascinating, you might say, while examining a perfectly ordinary headache. I've seen similar manifestations before, but never with quite this particular combination of symptoms. The patient feels special, you sound experienced, and everyone wins. And finally, you maintain an air of quiet confidence, even when everything goes wrong. If a treatment doesn't work, it's because the patient didn't follow instructions properly, or because their condition was more advanced than originally thought, or because interfering factors disrupted the natural healing process. It's never because you have no idea what you're doing, because in medieval medicine, perception is reality. If you look like a doctor, sound like a doctor, and act like a doctor, then you are a doctor. The actual healing, well, that's in God's hand. Your job is just to look wise while pointing toward heaven and charging a reasonable fee for the consultation. Your first patient of the day arrives at your door just as the morning church bells finish their call to prayer. It's Master Thomas, a wool merchant with fingers permanently stained from handling dyed cloth and a worried expression that suggests his problem is either serious or expensive, possibly both. "Doctor," he says, bowing slightly while holding out a ceramic flask. "My wife sends this with her compliments and urgent concern." You accept the flask with the gravity befitting such a momentous medical delivery. The urine is still warm. Freshness is crucial in uroscopy, the medieval art of diagnosing everything from love sickness to impending death based on the color, smell, and consistency of someone's morning constitution. You hold the flask up to catch the pale morning light filtering through your window. This is your moment to shine. Uroscopy isn't just medicine, it's performance art with bodily fluids. You've spent years perfecting the ritual, and now you execute it with the precision of a master craftsman. First, the visual inspection. You swirl the urine gently in its container, watching how it moves, looking for bubbles, sediment, or unusual coloring. Thomas's wife has produced a specimen that's a lovely pale yellow, what you might call straw-colored if you were being poetic, which you often are when discussing bodily functions. You hold the flask higher, angling it toward the window. The morning light passes through the liquid, creating a warm golden glow that would be quite beautiful if you weren't analyzing someone's waste products. You make a thoughtful humming sound, as if the urine is revealing its secrets to you personally. "Interesting," you murmur, though it's actually quite ordinary urine. But ordinary doesn't pay the bills. Next comes the aromatic evaluation. You remove the stopper and inhale carefully, not too deeply, because some specimens can be quite aggressive. Thomas's wife's urine has a mild, slightly sweet scent with undertones of whatever she had for dinner last night. You nod knowingly, As if this tells you everything you need to know about her internal spiritual and physical condition. The humors are speaking, you announce solemnly. Thomas leans forward, anxious for your professional interpretation. His wife has been complaining of fatigue, occasional dizziness, and what she describes as a heaviness in her bone. In reality, she's probably just tired from managing a household, several children, and a husband who travels frequently on business. But you can't very well charge someone for telling them their wife is exhausted from normal life. You consult your urine wheel, a circular chart that you keep prominently displayed in your consultation area. The wheel shows different colors and their supposed meanings, ranging from clear, cold, and moist constitution, to deep orange, excessive heat in the liver, to the dreaded blue-green supernatural influence or poison. The color suggests a cooling of the natural heat. You explain, pointing to the appropriate section of the wheel. The clarity indicates that her vital spirits are strong, but the slight cloudiness here, you indicate some perfectly normal particles floating in the liquid, suggests an accumulation of gross humors in the lower regions. Thomas nods seriously, though he has no idea what any of this means. Neither do you really, but that's not the point. The point is to provide an explanation that sounds learned, addresses his concerns, and gives you a clear treatment plan. You warm the urine slightly over a candle, not enough to cook it, just enough to awaken the humors and release any hidden vapors. This is entirely unnecessary from a medical standpoint, but it looks impressively scientific and gives you time to think about your diagnosis. Yes, you say finally, setting the flask down with ceremony. Your wife suffers from an excess of phlegmatic humors, complicated by a slight corruption of the blood. This is not uncommon in women of her age and station, particularly during the changing seasons. This diagnosis is broad enough to cover almost any complaint, while specific enough to sound professional. Phlegmatic excess can cause fatigue, dizziness, and general malaise. Blood corruption explains any other symptoms. The reference to seasons makes it seem natural and temporary. What must be done? Thomas asks, reaching for his purse. You prescribe your standard treatment for humoral imbalance, a gentle bloodletting to reduce the corrupted blood, followed by a regimen of warming foods to counteract the cold, moist phlegm. She should eat more ginger, avoid cold drinks, take moderate exercise in the morning air, and drink a tonic of wine mixed with honey and crushed herbs. Also, you add, because this is important, she should avoid becoming overheated or overly excited. Strong emotions can disturb the humoral balance and set back her recovery. You write out the prescription on a piece of parchment, using your most elaborate handwriting in plenty of Latin terms. Thomas can't read it, but he'll show it to the apothecary, who will nod wisely and prepare something close to what you've recommended. Thomas pays you 3 silver coins and a promise to send word of his wife's progress. As he leaves, you make a note on your wax tablet. Merchant's wife, phlegmatic excess, bloodletting recommended. Follow in 1 week. The next patient is already waiting outside your door. A young man with a swollen jaw who's been sent by his master. This one will be easier. Tooth pain is obvious, and the treatment is straightforward if brutal. You'll examine the tooth, determine whether it can be saved with herbal remedies, or needs to be extracted with your iron pliers. But first you'll need to see his urine, because in medieval medicine, everything starts with urine. It's the window to the soul, the mirror of the body's internal state, and the foundation of all proper diagnosis. Plus, it's really hard to fake, so you know the patient isn't lying about their symptom. You prepare another flask and explain to the young man that before you can treat his tooth, you need to understand the overall condition of his humors. He looks confused but complies. After all, you're the doctor, And if you say tooth pain requires urine analysis, then it must be true. Within minutes, you're swirling another specimen in the morning light, inhaling thoughtfully, and consulting your wheel. Medieval medicine, where every problem starts with a warm cup of someone else's bodily fluids, and somehow people pay you for this expertise. The beautiful thing about uroscopy is that it's almost impossible to be completely wrong. Whatever you see in the urine, you can connect to whatever symptoms the patient presents. Cloudy urine, corrupted humors, clear urine, cold constitution, dark urine, excessive heat, sweet-smelling urine. Actually, that one might indicate what we now know as diabetes. But you won't figure that out for another few centuries. For now, you're content to be the neighborhood urine expert, dispensing wisdom one flask at a time, and building a reputation as a man who can divine the secrets of the human body just by examining what it discards. It's not the most glamorous job in the world, but it pays the bills and gives you a sense of professional accomplishment. After all, who else is going to do it? After examining your morning specimens and sending your patients home with carefully written prescriptions, you settle into your study to review the theoretical foundation of your medical practice. This isn't just academic exercise. Understanding humoral theory is literally your job, your income, and your professional reputation all rolled into one complex system of bodily fluids and cosmic balance. You pull out your most prized possession, a hand-copied manuscript of Galen's writings, annotated with notes from your medical training. The parchment is worn smooth from handling, and some pages are stained with various substances you'd rather not remember. But this book represents everything you know about how the human body works. And in the medieval world, that means understanding the four humors. The theory is elegant in its simplicity, which is part of its appeal. According to the ancient Greeks, whose wisdom you follow religiously, the human body contains four essential fluids: blood, phlegm, yellow bile, and black bile. Each humor has its own characteristics, and health depends on keeping them in perfect balance. Disease occurs when one humor becomes dominant, deficient, or corrupted. Blood is hot and moist, associated with air, spring, and the sanguine temperament. People with too much blood are cheerful, optimistic, and ruddy-faced, but they can also become overheated, feverish, and prone to inflammation. When you see someone with red cheeks, rapid pulse, and energetic behavior, you know immediately that their blood is in excess. Phlegm is cold and moist, linked to water, winter, and the phlegmatic temperament. Excess phlegm causes lethargy, pale complexion, and what people call thickness of thought and movement. These patients are sluggish, catch cold easily, and produce excessive mucus. They need warming treatments to dry out the excess moisture and heat up their cold constitution. Yellow bile is hot and dry, connected to fire, summer, and the choleric temperament. When yellow bile dominates, patients become irritable, quick-tempered, and prone to vomiting. They have yellow-tinged skin, bitter taste in their mouth, and explosive anger. These people need cooling, moistening treatments to balance their fiery nature. Black bile is cold and dry, associated with earth, autumn, and the melancholic temperament. This is the most dangerous humor because it causes depression, fear, and what you recognize as madness. Black bile patients are pessimistic, withdrawn, and obsessed with death. They need warming, moistening treatments, but they're often difficult to cure because their condition affects both body and soul. What makes this system so useful is that it explains everything. Every personality trait, every disease, every emotional state can be traced back to humoral imbalance. A patient who's angry, too much yellow bile. Someone who's sad, excess black bile. A person who's overly romantic, definitely too much blood. It's a comprehensive theory of human nature that also provides clear treatment guidelines. You trace your finger along a diagram showing how the humors correspond to different body parts. The liver produces yellow bile, the spleen manages black bile, the brain generates phlegm, and the heart creates blood. Each organ has its role in maintaining balance, and disease occurs when any organ fails to properly regulate its humor. The seasonal connections are particularly important in your practice. You see more blood-related disorders in spring, when the warming weather heats up people's natural blood. Summer brings yellow bile problems as the heat intensifies choleric temperaments. Fall increases black bile, melancholy as people face the dying year. Winter causes phlegmatic complaints as cold weather thickens people's natural moisture. Age factors into the system too. Children are naturally hot and moist, dominated by blood, which explains their energy and growth. Young adults balance between blood and yellow bile, making them passionate and ambitious. Middle-aged people tend toward yellow bile, becoming more serious and irritable. Elderly individuals accumulate black bile and phlegm, becoming cold, dry, and melancholic. Your treatment philosophy flows directly from this understanding. If someone has too much of a hot humor, you prescribe cold treatments. Too much of a cold humor requires warming remedies. Dry conditions need moistening, and wet conditions need drying. It's all about creating balance through opposition. This is why bloodletting works so well for so many conditions. Since blood is hot and moist, removing some blood automatically cools and dries the patient. Whether they have fever, headache, or just general malaise, bloodletting addresses the most common cause of disease, excess blood. Diet plays a crucial role in your treatments, because different foods have different humoral qualities. Hot, dry foods like ginger and pepper increase yellow bile. Cold, moist foods like lettuce and fish increase phlegm. You can literally prescribe a humoral rebalancing through careful meal planning. The beauty of humoral theory is that it's completely internally consistent. When treatments don't work, it's not because the theory is wrong. It's because you haven't correctly identified the humoral imbalance, or because other factors are interfering with the natural healing process. Maybe the patient isn't following the prescribed diet, or perhaps the stars are influencing their humors in unexpected ways. You close the manuscript and lean back in your chair, satisfied with your morning review. Humoral theory gives you a framework for understanding every patient, every disease, and every treatment. It connects physical health to personality, diet to disease, and season to symptoms in one elegant system. More importantly, it gives you authority. When you walk into a sick room and announce that the patient suffers from excessive yellow bile, complicated by corrupted phlegm, you're not just guessing. You're applying centuries of medical wisdom to diagnose their condition. The fact that this diagnosis might be completely wrong is irrelevant. What matters is that you have a systematic approach that sounds learned and provides clear treatment options. Outside your window, you can hear the town coming to life. Merchants are setting up their stalls, animals are being led to pasture, and people are beginning their daily routine. All of them are walking examples of humoral theory in action. Sanguine merchants cheerfully hawking their wares, phlegmatic farmers moving slowly but steadily about their work, choleric craftsmen arguing over prices, and melancholic scholars reading in quiet corners. Your job is to keep all these humors in balance, one patient at a time. It's not easy work, but it's honest work, and it pays well enough to keep you in books, wine, and the respect of your community. You reach for your next patient's file. Time to put theory into practice once again. Your medical bag sits heavy on your shoulder as you prepare for house calls, and for good reason. Inside this leather satchel lies everything you need to practice medieval medicine. A collection of instruments that would make a modern surgeon weep and a patient faint just from looking at them. You open the bag on your consultation table, laying out each tool with the care of a craftsman displaying his finest work. These aren't just instruments, they're the physical manifestation of your medical authority, and their very presence can sometimes heal patients through the power of intimidation alone. Your knives come first. You own several, each supposedly designed for different purposes, though in reality they're all just knives of varying sizes and sharpness. The largest, which you optimistically call a surgical blade, is about as sharp as a modern butter knife, and twice as thick. It's made of iron, occasionally sharpened, and has a wooden handle wrapped in leather for grip. The smaller knives are for more delicate work, lancing boils, cutting away infected flesh, or performing what you generously term precise surgical procedures. One has a curved blade that's supposedly better for following the natural contours of the body. Another has a hooked tip for grabbing and pulling things that don't want to come out voluntarily. Your bone saw is a masterpiece of medieval engineering, which is to say it's a serrated metal blade attached to a wooden handle, and you use it exactly as infrequently as possible. Amputations are serious business, not just because they're dangerous for the patient, but because they're exhausting for you. Sawing through bone with medieval tools is hard work, and there's no anesthesia to keep the patient still. Your cupping horns are perhaps your most frequently used tools, made from actual animal horns with the tips cut off. They're used for bloodletting through suction. You heat the horn with a candle, place it over a small cut, and as it cools it draws blood out of the wound. It's more controlled than simply opening a vein, and patients seem to find the process less terrifying than watching their life force pour into a bowl. The cauterizing irons are your solution to infection and bleeding. These iron rods with shaped tips are heated in a fire until they glow red hot, then applied to wounds to seal them shut. The screaming is unfortunate, but the technique actually works. The heat kills infection and stops bleeding. You just wish someone would invent a better way to heat the irons than carrying around a portable brazier. Your bone drill looks exactly like what it is: a metal screw attached to a wooden handle. When someone has a head injury and you suspect pressure on the brain, you drill holes in their skull to relieve it. This procedure, called trepanation, is surprisingly successful when done correctly, though correctly is a relative term when you're working without proper lighting, anesthesia, or understanding of brain anatomy. The tooth-pulling pliers are brutally simple: metal jaws designed to grip teeth and yank them out of people's heads. They're not particularly precise, and you've accidentally broken more than one jaw while attempting to remove a stubborn molar, but they get the job done. Most dental problems in the medieval period are solved by removal rather than repair. Your collection of probes and picks serves various purposes, from examining wounds to removing foreign objects to poking around inside people to see what's wrong. They're made of iron or bronze with different shapes for different purposes. Some are straight, others curved, and a few have spoon-shaped ends for scooping out unwanted material. The forceps are your precision instruments, used for grasping small objects, removing splinters, or holding tissue during procedures. They look like oversized tweezers and work about as well as you'd expect from medieval metallurgy. Sometimes they grip perfectly, sometimes they slip at crucial moments. Your mortar and pestle are essential for preparing medicines. Made of stone or metal, they're used to grind herbs, mix powders, and create the various pastes and ointments that form the basis of your pharmaceutical practice. The pestle fits your hand perfectly after years of use, and you can reduce almost any plant material to powder with enough time and effort. The enema syringe is a wooden tube with a plunger, used for administering liquid medicines directly into the patient's bowels. This is considered an efficient way to deliver drugs quickly to the system, and many of your treatments involve flushing out corrupted humors through vigorous bowel movements. The syringe is reusable, which is economical though not particularly hygienic. Your bloodletting bowl is a simple but essential ceramic vessel, wide and shallow, designed to catch blood during vivisection. You actually own several in different sizes depending on how much blood you plan to remove. The bowls are glazed inside to make cleaning easier, and you've marked measurement lines on some of them to track exactly how much blood you're taking. The phlegm is your primary bloodletting tool, a sharp leaf-shaped blade attached to a wooden handle. You place it against a vein, then strike it with a small hammer to open the blood vessel. It's more controlled than using a knife, and the consistent blade shape makes for cleaner cuts that heal more predictably. Your collection of specula allows you to examine body openings more thoroughly. These metal instruments, shaped like small funnels or tubes, can be inserted into various orifices to hold them open while you peer inside with a candle or oil lamp. They're not comfortable for the patient, but they allow you to see things that would otherwise remain hidden. The truss is your solution for hernias, a leather and metal contraption that holds protruding organs in place through external pressure. It's not a cure, but it allows people with hernias to function relatively normally. Fitting a truss requires careful measurement and adjustment, and you take pride in your ability to create custom solutions for each patient's needs. Your surgical needles are made of bone or bronze, with eyes large enough to accommodate thick silk or linen thread. Stitching wounds closed is one of your most important skills, and these needles have sewn up everything from kitchen accidents to battle injuries. They're not as fine as modern needles, but they're sturdy and reliable. The lithotomy knife is specialized for removing bladder stones, one of the most dreaded operations in medieval medicine. The blade is curved and sharp, designed to cut into the perineum and extract stones through manual manipulation. It's dangerous, painful, and frequently fatal, but sometimes it's the only option for patients suffering from severe urinary blockages. Finally, your collection of balances and measures ensures accurate dosing of medicines. These small scales can weigh precious herbs and powders to the grain, allowing you to create consistent